to the first fill. My name is Ayo Edefioye, and I serve as the Advanced Education Fellow at APHA, and I'll be the host for today's episode. In part one, we discussed a recent Lancet oncology article on hormone therapy use and young onset breast cancer, focusing on the study's design, its findings, and how it adds to what we know from previous research like the Women's Health Initiative. Today, I am delighted to be joined by APHA member Allison Reed. As I said, I am really excited to have you here today, Allison. Welcome to the first fill. Before we start, could you please introduce yourself to our listeners and share a bit about your practice setting and experience?
Absolutely, Io. Thanks so much for having me. So, my name is Allison Reed, and I am a clinical oncology pharmacist at the Stephanie Spielman Comprehensive Breast Center in Columbus, Ohio, under The Ohio State University. So, I work every day with breast cancer patients who have breast cancer and the oncologist to help create a collaborative treatment plan for them and ensure that their adverse effects are being addressed and ensure that medications that we are giving them are safe.
Sounds good. Thank you for that insight. So let's dive in. In episode one, we discussed the use of hormone therapy for women under 55 based on the study recently published in The Lancet conducted by the Premenopausal Breast Cancer Collaborative Group. Allison, how do you think these findings will influence future research or clinical guidelines related to hormone therapy and breast cancer prevention in younger women?
This is honestly a great question. I feel like this study really highlights the need for all studies to be more inclusive of patients who are premenopausal and who have used or are currently using hormone replacement therapy. As the article highlighted, premenopausal women have been largely excluded from these trials and studies. And I feel like this really shows the need that we know some, but we don't know everything there is to know. And it's important now more than ever to have the appropriate information about these therapies because patients are getting information from several different directions and they might not always be getting the full picture of the data. So, as the medication experts, we have the knowledge to analyze these studies appropriately, but we can't adequately discuss them if the in depth studies don't exist. So, while this study, in my opinion, is going in the right direction to allow us to be able to speak confidently to the risks and benefits of hormone replacement therapy in premenopausal patients, I would like to see more studies done, especially with more uniform gathering of data, which are one of the limitations of this study.
I agree. Thank you for that, Allison. Over the years, we've seen mixed clinical opinions in hormones and breast cancer. How do you see this new study impacting beliefs around the use of hormone replacement therapy in premenopausal women?
I believe that this study will allow providers to start being more accepting of hormone replacement therapy, in particular the estrogen monotherapy replacement in patients who do not have a uterus, because this study does show there is an inverse relationship between estrogen monotherapy and invasive breast cancer risk. Estrogen may be an appropriate option for patients who are experiencing menopausal symptoms. Of course, we need to discuss the risks and benefits with patients and ensure that they are aware of the non hormonal options that are available to them. But of course, those aren't without risks either. This will definitely open up the conversations between patients and providers. However, on the other hand, I do remain cautious with using estrogen and progestin combination therapies because of that increased risk of breast cancer in women, especially those who have used it for more than 2 years and those who didn't have a history of a gynecologic surgery. So those are just some factors I think we should consider when thinking about patients who might be wanting these hormone replacement therapies.
How do you see this study impacting the way you educate premenopausal/ younger patients who inquire about the use of hormone replacement therapy?
So that is a bit of an interesting question because I do see patients who already have a breast cancer diagnosis. So this doesn't necessarily, I think, change anything in my day-to-day practice. But in pharmacists who may interact with patients prior to a breast cancer diagnosis, um, I think that just educating them that hormone replacement therapy is an option to include in that conversation, but ensuring that they are aware of all the risks and potential benefits during those conversations. Um, in the retail setting, you may only have the medication list available to you for the source of their health, but that's not always the full picture. So I think also ensuring that we are asking those probing and open-ended questions in order to be able to provide the most accurate answer is something to remember. And also to remember that sometimes patients do shop around for other medications just to get the lowest price. And so knowing that those limitations that we work with within the retail setting as well.
Finally, any parting words for our guests regarding how clinicians should be incorporating findings from the study into their practice?
I think just to keep in mind that it's a complex topic and to not be afraid of collaborating with other pharmacy specialists when considering hormone replacement therapy because there are many factors that are that are modifiable and then some that are not modifiable that can contribute to breast cancer risk, and it's not an all one size fits all situation by any means. It's also important to keep up with the literature because new information is being published constantly, including information on non-hormonal options. For example, Friday there was a medication approved by the FDA, and that's a non-hormonal option for hot flashes and vasomotor symptoms. So and that was just between the last episode and the episode we're recording today. So ensuring that we are staying up to date with the literature so that patients can have a full picture of the options that are available to them and make that educated decision based on the risks and benefits.
Well, Allison, thank you so much for joining us today and sharing your expertise. This has been a great review of the use of hormone therapy in young onset breast cancer, and I appreciate you sharing your experiences using them thus far. All right, let's summarize major takeaways from our time here today. Premenopausal women have been largely excluded from studies related to use of hormone replacement therapy, and this study provides useful information to help pharmacists have more thoughtful conversations with their patients. The study showed an inverse relationship between estrogen monotherapy and invasive breast cancer in young women, allowing for more confidence with use of hormone replacement therapy in this population. Pharmacists can educate patients about both risk and benefits of hormone replacement therapy and should ensure that they have the full picture in order to provide the most accurate answers possible. Pharmacists can also collaborate with other specialists to determine the best path forward for each individual patient. All right, folks, that's all for this month's episode of The First Fill. If you're looking for more content in the oncology space, we have two Pharmacy Today continuing education opportunities on breast cancer and prostate cancer. APHA members have free access to this important content. And as always, don't forget to visit the Learning Library at learn.pharmacist.com to earn CE credit for this month's podcast. Take care and thanks for listening.